India's trauma care push gets a boost as HOSMAT launches Golden A network at first-of-its-kind Trauma Conclave *. Bengaluru, 28 March 2026. In a significant step towards strengthening trauma care systems in India, HOSMAT Hospitals, a leader in orthopedics and trauma care, in collaboration with the Bangalore Orthopaedic Society, successfully hosted HOSMAT Traumacon 2026, a first-of-its-kind, practice-driven trauma conference, marked by the formal launch of the HOSMAT Alumni Association and Golden A Network, GHN, Star. Positioned as a pioneering initiative, the Golden A Network is a structured, professional trauma care community that brings together surgeons trained within the HOSMAT ecosystem under a shared commitment to rapid, precise, and outcome-driven trauma care. More than an alumni collective, GHN is designed as a coherent clinical and academic network with a defined program of monthly clinical rounds, quarterly specialty-focused discussions, and an annual TraumaCon gathering as its apex platform. Named after the critical, golden hour, the first hour following injury where timely intervention determines survival, the network reflects a deeper philosophy. That trauma care is not defined by institutions, but by
when it comes to patient care. There's a lot that can be done during that small, narrow window, and we wanted to highlight that and see what we can do to shed light on the importance, what needs to be done, and just the logistics behind it. And given that we are one of the leading trauma centers in South India, I wanted to really make sure that this is something that we are addressing. And given that my father, the late Dr. Chani, is an orthopedic surgeon, I thought that it would make the most amount of sense to highlight TraumaCon as a memory to him, because this is something that was very near and dear to his heart. So this is what brought upon the opening of TraumaCon in honor of Dr. Chandy, and given the overwhelming responses and recognition, we are hoping to make this an annual thing moving forward.
Madam, this one. I think the guidelines are still set, but I want to know what is the objects and purpose and how that you want to...
The things that Dr. Chandy always focused on was educating other doctors. I think most of the doctors that we see here, over here, and even at the conference have all been introduced, worked with, or have heard of Dr. Chandy, and he started a community of doctors as a result of that. So what TraumaCon is doing is bringing in all of these doctors and having a community base of doctors who share the same belief of the importance of trauma care, world-class care, and really shaping all of that. Medical tourism is moving at an alarming rate in India, and we need to broadcast and share the importance of how India is one of the best places for medical tourism in general. And orthopedics is one of the places to go for future joint replacement. That is like a given that everyone knows about, and I want to make sure that we are highlighting that and bringing that together. So the future of TraumaCon is bringing this community of doctors together to share their expertise, their research, their information on this, sharing it with their colleagues and seeing what we can do to continue highlighting these ideas, broadcasting them, and basically elevating it to making Bangalore a trauma hub for India and for the world.
So how much challenge for you to take this legacy forward?
It is definitely, it is a very humbling experience because Dr. Chandy is a household name. I have spent so much of my time being known as Dr. Chandy's daughter, and that hasn't changed at all. So being able to just step into those shoes has been very, very humbling. It's been something that I have committed myself to doing, and I live by his legacy, and in almost all of my decisions I always say, what would Dr. Chandy do in this? What would he want for the future of HOSMAT? What will I want to see this happen in HOSMAT? So it is humbling and it is exciting, and I'm always thinking about what he would do in the same process.
How will TraumaCon help the rural clinics to boost national survival rates?
That is a good question. I'm the only one talking over here.
Yes, I would like to answer. We have touched the lives of around 25 lakh people in Bangalore, in this HOSMAT hospital from the past 33 years, and around 6.5 lakh IP. So almost one third of the population of the city we have touched directly or indirectly. And we are one of the fastest growing, and we operate almost 30 to 35 cases per day. And average footfall is around 300 cases in our OPD. And we are always within 5 in the national rating as the best orthopedic hospital for the past 10 years. And we are doing a fantastic academic work. Like we have got more than 300 research and academic activities with more than 80 international publications in index journals. That's a very good activity in a private setup. I think that should be a commanding job what we are doing, because the consultants here are more oriented towards academic also. And we have got the highest intake of one of the highest intake of DNB candidates. Our passing rate is 95%. So that itself speaks that all the candidates who passed, they go to different parts of the India and they try to work to the best of their ability.
How is the
President of Bangalore Orthopaedic Society. Before answering your question on AI, as our other pressman asked about the rural, what HOSMAT has contributed to the rural setup. See, we all have come from a rural background. When we enter Bangalore, when I came in 2004, I had come from a rural setup, and along with me there are more than 100 orthopedic surgeons who, those days, they all have come from places which is like in and around small areas of Karnataka. Today they are the leading orthopedic surgeons. So we thank HOSMAT and Professor Chandy for giving this opportunity to become better orthopedic surgeons with such a good quality of training. So I'm sure it has reached the rural places because of HOSMAT. Because HOSMAT, people think it is name of a doctor. So they used to come here and ask for Dr. HOSMAT because it's such a familiar name.
Surname.
Madam, in a lighter vein, I used to say Dr. Chandy, people used to come. Second half of the journey, people started coming to HOSMAT. I said in a lighter vein that probably, sir, the brand has overtaken you. He said, that's what I expected. That's the best part of him.
See, I'll give an example. One girl from Krishnagiri came where the car amputed, otherwise the child will die. Fortunately, they brought to the HOSMAT. Dr. Chandy examined the child and said, she is young. We can save her leg. And we saved the leg by multiple surgeries. The girl was so determined. Now she has done MBBS from the Dharampuri Medical College. She's a doctor. One more instance, when Dr. Chandy was admitted in Manipal, one doctor came, Miss Sims, and said, thank you very much, doctor, because of you I am a doctor. I said, why? He was surprised when a doctor is telling like that. Then when that was a child, he came to HOSMAT. Again he had a bluish discoloration. There is no circulation in hand after injury. Dr. Chandy, after examining that child, told that parents of that child, no, you don't amputate. Definitely this limb will survive because he is young. So accordingly, limb was survived and he became a doctor. So like that. And also, doctor introduced a scheme called Good Samaritan Award. That is called HOSMAT Good Samaritan Award. The first awardee was Venkatesh Prasad, the cricketer. So when he was playing active cricket, after his practice from Chinnaswamy Stadium, he was going back to his house in Indiranagar. He saw an accident in him on the MG Road. And immediately, without hesitation, he shifted that victim in a car and shifted to HOSMAT. He had a severe injury, Mr. Manjunath, and he saved his life. And he was the first recipient of the HOSMAT Good Samaritan Award. On April 1st, in our Dr. Salim's office, IGP, we are giving a Good Samaritan Award to a head constable because one person was lying on the railway track, wanted to commit suicide. That head constable gets a message, and using the cheetah, he reaches the spot and he saves the life. So like that, Dr. Chandy has done many things. So he was telling me, see, accident can happen to anyone. It is not only for the rich, for poor also. Many poor people we have helped. There are 3 foundations: HOSMAT Poor Patient Foundation, HOSMAT Handicapped Children Poor Foundation, and HOSMAT Foundation. So we try to help the poor patients through those foundations. And
got new ambulance with fleets that were upgrading and bringing in on a regular basis. There is a kind of
a convening with the surgeons, networking essentially. With every conference, that's the ultimate takeaway, the ultimate main thing. And just like Doctor said over here, this is no different. This can build a lot of networks and connections with what Dr. Chandy has built with all of his students, the people even that he mentored, and people that he worked with. I think that honors his legacy in the best way, because not only was he a great doctor, very technical, he was also very, very social, and that I think this is both of his worlds convening in that way. So
Any idea?
So it makes it absolutely, sure that everything is going well.
Okay, what values or visions of Dr. Chandy are being carried forward through this?
he was determined to make healthcare accessible and affordable. Values and the mission of the hospital is instilled in everyone, from the doctors down to like the security and people who are working over there. So we want to make sure that that is what continues, and that Dr. Chandy's spirit is really honored in Bangalore and in HOSMAT in general.
Does HOSMAT take the aid of